Okay, started your timer and here is your question. Right, so if you have read and understood, considering its surgical and optimization, kindly tell me what are you looking at? And if you can, yes, identify.
This is the prosected image of the anterior abdominal wall.
All right.
Ma'am, the structure A is the linea alba.
Yes. What is lineal?
Uh, Ma'am, it is a band of aponeurotic band of abdominal muscles in the midline
Yes. Which extends
and
from where to where?
extends from the fish sternum to the pubic symphysis.
Does it? Okay. What is B, please?
D is the and that's the rectus abdominis muscle.
Okay. What is the origin and insertion of rectus abdominis muscle? Please?
Ma'am, rectus abdominis muscle is from the uh, again from the from the subcostal line to the pubic symphysis.
What is the direction of the fibers of this muscle?
Ma'am, vertical.
Can you identify C, please?
Sorry,
C?
that is the external oblique muscle.
D, please?
D is the rectus abdominis one.
Okay. E?
E is the superficial epigastric vessel.
F, please?
Umbilicus.
Okay. What is the dermatome of umbilicus?
T10.
Okay. Can you also identify G, please?
Ma'am, that is the posterior rectus sheath behind the rectus abdominis muscle.
Okay. So if I ask you about the muscles of the muscles which form the abdominal wall from outside to inside, how would they be?
Ma'am, laterally, there is the external oblique muscle, then the internal oblique muscle, the transverse abdominis muscle, and the fascia transversalis. In the medial part, there is the rectus abdominis muscle, and uh, below that is the posterior rectus sheath and the external extraperitoneal fat and the parietal peritoneum.
Okay, can you please tell me what are the contents? What is rectus sheath first, and then kindly tell me the contents of rectus sheath.
No, rectus sheath is a facial covering over the rectus abdominis muscle. It is the tendon sheath which encloses the rectus abdominis muscle and the pyramidalis muscle, which is the extension of the external oblique, internal oblique, and the transverse abdominis muscles.
Yes.
And the contents are the rectus abdominis muscle, the pyramidalis muscle, pyramidalis muscle, and the inferior and superior epigastric vessels, as well as the sympathetic fibers from T7 to T11, 12.
Can you please tell me the surface marking of the arcuate line and its significance as well?
Approximately 1/3 of the distance from the umbilicus to the pubic symphysis is the location. of the arcuate line, and this is the lower limit for the posterior rectus sheath, ma'am.
All right. Can you please tell me what is the distal limit of fascia scarpa?
The distal limit is till the hip, ma'am. It fuses with the fascia lata 1 centimeter below the inguinal ligament.
And what is the continuation of this fascia scarpa in the perineum? What does it
It
call?
continues as the Colles fascia in the perineum.
Okay. Can you please tell me where is the median umbilical ligament located and what does it contain?
It is located in the anterior abdominal between the two medial umbilical ligament. It contains the urachus, which is contains the allantoins in the fetus, which connects the bladder in the fetus.
Okay. Where are the medial umbilical ligaments located and what do they contain? Medial.
Medial are located laterally to the median arcuate ligament, ma'am, umbilical ligament, and they contain the umbilical arteries, remnants of the umbilical arteries.
Okay, now I want you to focus on three muscles, right? And you have to tell me the direction of the fibers of internal oblique, external oblique, and transverse abdominis muscles.
Yes, ma'am.
And at
The
what level of the umbilicus they are, the direction that you are telling me?
All right, ma'am. The external oblique muscle is directed anteriorly and inferiorly at the umbilicus level of umbilicus, at the level of umbilicus, and the internal oblique muscle runs perpendicular to it, so it is superior. It is directed superiorly and medially, and the transverse abdominis muscle is directed transversely.
Okay. Can you please identify what are you looking at now? Can you identify the structures labeled?
Yes, ma'am. Structure A is the right renal vein. Structure B is the inferior vena cava. Structure C is the gonadal vein. Yes, then structure F is the left renal vein. Structure E is I don't know about the structure E. Structure G is the aorta, infrarenal aorta. Structure H is probably the ureter, and D is the suprarenal gland on the left side, ma'am.
All right. Okay. Can you please identify now first the picture on the left hand side and all the labeled structures?
Ma'am, this is angiogram of the abdominal aorta.
Very
A
good.
is the abdominal aorta. F is the splenic artery.
Yes.
Then G is the common hepatic artery. The J is the left branch and K is the right branch of hepatic artery. I is the gastroduodenal artery. E and D are the left and right renal arteries. H is probably the superior mesenteric artery, and L is the inferior mesenteric artery. B and C are left and right iliac arteries, common iliac arteries.
Okay. Now looking at the right hand side image. Yes. I'll only ask you to identify two structures which are here labeled in blue. This one.
And the one on the
39.
left is probably
Yes.
the vessel. It's probably the gonadal vessel, ma'am. And the other
And
one
this
I
one.
can't. And the image is very small. I can't like zoom it also.
Yes, yes. Just these two I have to know. All right, good.
Can't tell, ma'am. Sorry.
All right, okay. Right, if we can come back and come to this. Okay, this is linea alba. What was the significance of linea alba, you told me? Did I ask you? What is the significance? Why should you know about the linea alba? Are you there? As a surgeon,
Yes, ma'am.
like
Yes, ma'am. As it is avascular,
avascular, yes.
midline incisions are taken on the linea alba to avoid any
So
bleeding or
yes, very good.
inadvertent bleeding.
So B was here. It says B is
It is a tendinous insertion of the
yes.
yes, ma'am. Yes.
C was external oblique, and D was rectus abdominis. E was superficial epigastric vessel.
Yes.
So this is the vessel that they are pointing at. F, you were correct, umbilicus, and G was posterior.
Posterior rectus sheath. Yes.
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 Good. Right, about the external oblique fibers, they run inferiorly and anteriorly. Internal oblique fibers run perpendicular to the external oblique muscle, directed superiorly and anteriorly, and whereas transversus abdominis fibers, they run transversely at the level
Yes.
of
Okay.
umbilicus. So that's what that is. Right.
Yes.
All the rest you had it right. So thank you.